Thank you for joining us for this panel on racial equity. I'm pleased to be joined by Commissioner Dennis Deere, Commissioner Alma Anaya, and Commissioner Kevin Morrison. I'm going to give each of them an opportunity to introduce themselves and to talk a little bit about what racial equity means to them. Commissioner Deere.
I am Cook County Commissioner Deere, Commissioner of the 2nd District, where we are, so welcome to the 2nd District. Racial equity is something that's very, very important to me. I believe that equality should exist wherever we go. I have spent a considerable amount of my time working for disadvantaged populations who have been disadvantaged in many areas. I think that equity is something that we all should be advocating for and making sure that we have appropriate policies in place so that all individuals are included. Madam President, I want to congratulate you on your leadership as it relates to racial equity and equity in general. You started this a long time ago, and I want to say thank you.
Thank you very much, Commissioner.
Thank you.
Commissioner Anaya.
So first of all, thanks, Madam President, for having this panel. As we move forward, we must look at the ways that equity needs to be implemented in our policy, and especially since we work a lot with legislation at the county level, so I appreciate this conversation. I think equity and racial equity specifically is very important because historically and very systematically we've seen that there's been resources and policies and legislation that has benefited some people, all while harming other communities, specifically communities of color. And as we look at those policies that have been so engraved into the way that we manage a lot of our inner workings, it is specifically important to see how we can now shift that and start helping communities to thrive in very different ways. So I'm excited to be having this conversation. I know that this is a great time, especially now that we have the Racial Equity and Equity Committee to have this discussion and look at the ways that we're going to be able to change and implement those changes.
Thank you.
Of course. Thank you, Madam President, and we appreciate you taking the leadership this week and having this conversation. I'm Kevin Morrison. I'm the Commissioner representing the 15th District in the Northwest Suburbs. Racial equity is incredibly important to me. As someone who has not faced racism myself, being an individual who is a member of the LGBTQ community, I have faced discrimination, and I do know the horrible feelings that places on an individual. And I think that any work we can do to face and start changing the narrative to get rid of all inequity that faces many different communities is incredibly important as we continue. One of the reasons why I decided to bring about the conversation early in my tenure of creating a committee on addressing bias, equity, and cultural competency in the Cook County workforce and in Cook County in general, which you supported early on, and I thank you for that, is because we need to do a better job as a government in facing not only racial inequality, but also making sure that we are spreading equity as it goes to the LGBTQ community, individuals with disabilities, people who are from economic disparities. And it is incredibly important that we continue this work together, and we thank you again for this conversation.
Well, thank you. You know, the President's Office and our Board of Commissioners have always been concerned about equity. That's kind of a foundational issue for us. We provide health care. That's half of our budget. And we've always provided care for 180 years to anybody who came to our door, regardless of their race or their religion or their sexual orientation or their ability to pay or their documentation status. So equity has always been kind of built into our healthcare system. And many of you have supported our criminal justice reform efforts. I know that Commissioner Anaya and Commissioner Morrison are new to the body, but Commissioner Deere, of course, has been here a little longer. And we have worked under my tenure very hard on criminal justice reform, and we know that that disproportionately impacts communities of color,
yes,
the African American and Latinx communities, which are about half of our population, but 86% of the population in our jail.
Yes.
So concerns around equity have been kind of built into the legacy missions of the county historically. And for the last 2.5 years, we focused particularly on racial equity. We had a 1.5 year long planning process that involved not only our staff but outreach to our residents around the racial equity issue. We produced a report last year, and for the first time this year, September 16th through 20th, we'll have a Racial Equity Week in Cook County. And I'm very proud of the work that we have done and the work that we look forward to. I want to ask each of you, why should equity matter, and how does Cook County government kind of fit into the equity picture? We'll start with you.
Thank you, Madam President. I think equity should matter because no group should be polarized and separated because of their race, because of their sexual orientation, or because of their belief system. I live in an area that's called North Lawndale. I was born and I was raised there in North Lawndale, and I continue to raise my family there. It is a neighborhood where 70% of the males 18 to 45 are ex-incarcerated, and I'm so happy that you're doing the work
justice
around.
involved.
Yeah, justice involved, and I'm so happy that you're doing the work that you have around criminal justice reform. I think that is so important, but it is a disenfranchised community. I think that equity is important because in that same community, access to health care has been little to none in the past. And so I'm happy because of the work that Cook County Health and Hospital System does to provide that access to health care. But even more than that, sexually transmitted diseases statistically are at not just epidemic rates, but pandemic rates. And that is because the necessary education and the tradition of access to health care has just not been there for Black and brown communities. So I believe that it is important that government takes on equity, that it takes on racial injustices and inequalities. I also think it's important that we look at that even from the standpoint of economic development and how we give contracts out or how procurement takes place. Equity comes to government in that particular form as well. I always say the quote from Socrates: if you always do what you've always done, you always get what you always got. That's the definition of insanity, doing the same thing over and over again, expecting different results. And I'm happy that we're doing the first inaugural Racial Equity Week, the 16th and the 20th. And again, I'm thankful that we have leadership that is informed, but also empathetic to the issues of our constituency.
All right.
Commissioner
Morrison.
Madam President, for too long, racism has been perpetrated on many different levels by our government bodies across the nation. And this is why it's incredibly important that as we have more diversified legislative bodies, that we bring to the forefront policies that address the historical racism that we have faced as a nation. And it's one of the reasons why we talk about equity as opposed to inequality. Just making equal policies that fall the same across the board do not bring historically disenfranchised communities to the same starting line as everyone else. And so we need to do what is in our power to make sure when it comes to criminal justice or health care, or making sure that it comes to better operations for all county staff, and that the trainings are of a lens that ensures that when it comes to any service that this county gives to our incredible residents, that it is being done with a lens of equity. And I'm incredibly excited to be a part of this board and to see this conversation not only starting right here with this new board here in 2019, but to see what we're able to accomplish moving forward.
Thank you. You know, as the first openly LGBTQ member of our board, we're grateful for your engagement in this issue.
Absolutely.
Because, as you say, you come from a community that is discriminated against around sexual orientation rather than race. And there are a lot of groups in this country that have suffered discrimination. Not all of it is race-based. Some of it is sexual orientation and religion, for example. And all of us need to understand that we're all Americans, and we've got some challenges we need to address. And speaking of that, our office under the President have been doing work around racial equity. What is the committee doing to try to address equity, and how do you see that work aligning? I think this is a question for Commissioner Anaya. We'll start in the
Sure.
middle this time.
Sure. Well, we were very lucky to have Commissioner Morrison bring this up, and I know myself and Commissioner Moore and Deere were really excited that he asked us to be co-chairs. We have been looking at a lot of the policies that Cook County has at the moment, and we're very lucky that Commissioner Morrison and myself were able to travel to LA County and look at some of their initiatives that they've been doing there. I think that the work with the policy roadmap is very beneficial, and that was definitely a great first step. And I just hope that the committee and some of the recommendations that come out of this committee complement that. And the way that I see it complementing is that the conversations around healthy communities or thriving communities, which were some of the areas that the policy roadmap focused on, are things that we've been discussing. And although the policy roadmap is this great idea under the offices of the president, we have involved other independently electeds that are now joining the conversation and looking how can they examine the way that they're running their departments. For example, the sheriff's office, and we've had people from the assessor's office and looking into their internal policies, not only within their workforce, but also how they interact with our residents that come and access these services. So we're very lucky to be able to have both all the offices under Madam President and also all the independently electeds join forces and really look at the ways that internally and again externally we can make changes and complement each other on that end.
Good, thank you. Commissioner Morrison, I know that there are some policies that might be recommended in the Commission's report, and how do you think these will affect racial equity in Cook County?
Of course. Thank you for the question, Madam President. I think that the conversations that have been occurring with this committee, we have members from representing both separately elected as well as from external stakeholders as well, from everything from individuals who are heavily involved in the immigrant community or individuals fighting about disability rights or as well as people who are trying to fight against the racism that we are seeing throughout Cook County and have historically. And so I think from what we have learned of successful programs that have occurred across the country, that the first step would be to creating an Office of Equity here in the county. I think that is a crucial first step, and it would be a role that, for one, would show everyone here who is a part of Cook County government the importance that we see in equity. I think that's an important first step, and we will, as a committee, be coming with many recommendations as we conclude. I do think creating that office is a crucial first step, but I do think conversations with individuals in leadership throughout the county, have that conversation and go through some sort of formal training of what equity should mean in their individual offices. But I'm very much looking forward to seeing what we come up with and what we propose in the coming months.
Yeah, we've got some evangelism to do in terms
Yes.
of in terms of this issue. Commissioner Deere, I know that healthcare has always been your focus. You talked a little bit about sexually transmitted diseases and how
Yes.
they're pandemic in Black and brown communities. How does health affect racial equity? Or maybe how does racial equity affect health?
Affect
Maybe that's the
health.
better way to put it.
Well, it is. Thank you, Madam President. I think that healthcare, as you just said, is very important. I've spent the last 20 years as a psychologist in behavioral health care, and certainly racism has a huge impact. It has an impact because there are Black and brown communities and other communities who are marginalized because of the color of their skin, and in some cases because of their class. And so, for instance, I'm always talking about my district. Inglewood is a community on the south side of my district. Again, has many justice-involved individuals, but is a disadvantaged community. And there was a study that came out that essentially said that individuals who were from a community not far from here had better health care and a life expectancy of 90 years old, of 90 years of age, where individuals in Inglewood, just 20 minutes drive away, have a life expectancy of 60. That is an important statistic because healthcare has an impact. And individuals, obviously, from this particular area happen not to be black and brown, and individuals in Inglewood happen to be black and brown. So we know access to healthcare is important. We know health education is important. We know that education around disease is important. One of my fellow colleagues, Commissioner Johnson, made mention of having asthma, and just not having that small little pump or access to that small little pump could stop him from living. And so we have to make sure that we have equity in healthcare, that individuals have access to great healthcare. That actually helped to drive me to sponsor a resolution declaring racism a public health issue, simply because there are many communities all around Cook County who happen to be disadvantaged, and individuals have STDs, have pronounced health care issues, and it's because of a lack of appropriate health care that these issues essentially are going rampant.
There's some real challenges around the impact of healthcare inequities on communities.
Yes.
And the most
Huge.
obvious one is the one you began with, which is life expectancy.
Yes, yes, and I think that again, you called it evangelism. I love the word evangelism. I usually say a campaign of education, but I like evangelism a little bit more. We have a lot of evangelizing to do all around Cook County, and I believe that our constituency is ready for it. We're waiting for the right leader to come along and do it, and I think we see that in you, Madam President.
Well, thank you.
And I'd
Thank
like to add that to your point, Commissioner Deere, it's not a coincidence that in the same areas that you're talking about, in the areas where we see the disparity in health, we also see the school closings.
Yes.
We see the fact that there's food deserts, and they almost overlap to such a precise way. And we need to look at all of those factors, because all of those factors, access to education, access to healthcare, and good food and produce really do affect the life expectancy. And 30 years is a long time. It's a long time to see the life expectancy from one individual on one side of the city to another. And again, it's the health. It's the fact that our communities of color have higher diabetes. I know it's really high in the African American community, and there's just so many layers to it, and we need to look at all of those pieces, because just not one thing is going to fix it all. We need to see it all, a big picture, and see the little things that do affect it.
And PTSD.
Yes.
PTSD happens to be very, very high, and particularly in the African American community, because of the violence, because of the trauma that's associated. So all of those things kind of create this recipe that I call of disaster that I think we can appropriately change.
Former Education Secretary Arne Duncan, who is a Chicagoan, has talked about visiting public schools in Chicago and asking the young people, as young as kindergartners and first graders, if they know anybody who's been murdered. And there are always hands that go up. And sometimes he continues on, no, 2 people have been murdered, 3 people, and there's still hands in the room, our young people in our communities. As you say, so trauma is a real issue in many of our neighborhoods.
I personally know that's a fact. I saw my first murder at 10. 10
You
years
should tell
old.
the story.
10 years old. Should I tell it now?
Tell the story.
Please. So I saw my first murder at 10 years old, growing up in North Lawndale. I was on a back porch. It was the 3rd of July, 1982. Somebody's going to count and see how old I am now. But 1982, I'll never forget this in my life. I heard the firecrackers popping, but I actually saw a guy come through the alley running, and then there's a car pulled up. I heard a bunch of fussing and fighting. I'm looking, and then I saw them push a guy out, and then I saw what I thought was a firecracker was a gunshot, and the next thing I know, all the squad cars pulled up, and they came to my house. And obviously, in the neighborhood, you're always told, hey, don't say anything. My mother did allow me to talk to the police, and essentially there was an individual that was a drug dealer who got pushed out of the car and essentially, unfortunately, shot in the head. And I sat there as a youth and watched it, and I'll never forget that look in my life. So probably one of the reasons that I became a psychological clinician is because of that, because I was trying to figure out why. Why did people do what they did? And it happened in communities similar to North Lawndale, and it still happens today. And I was traumatized, and I did not know why. And unfortunately, in our community...
Probably didn't even know the word. But anyway.
I did not. Unfortunately, in our community, Madam President, in the African American community, we were always taught, don't go to a counselor, because that means you're crazy if you go to the counselor. And I always evangelize and say, go to the counselor. You're crazy if you don't go to the counselor. I didn't get to see a counselor until I got to college. And going through classes in psychology, you have to go to a counselor to work out your issues. That was the first time that I actually got to cry about that particular situation, is when I got in college. So imagine 10 years old all the way up to 19, I'm holding this in. And then people wonder why there are behavior problems inside of the school. They wonder why when Ernie Duncan comes, substance abuse, co-occurring disorders, and when the former Secretary of Education asks who knows somebody that has been murdered, I raised my hand, but that was a whole nother story, because I had a cousin that was murdered when I was 14 years old. And so this is what happens every single day, and it's almost like nobody cares. And I always said, if I'm ever in a position where I can impact change on a level that matters, I would champion these particular issues. And so by the grace of God, here I am.
And violence is an equity issue.
It is.
Because the violence plagues are most challenged African American and Latinx communities.
Yes.
That's where the violence is most prevalent.
It is, in a huge way.
Let's shift gears for a minute here. Commissioner Morrison, what's your vision for Cook County where inequities are erased, where there is equity?
Well, I would have to echo with something that Commissioner Deere just touched on. I think that to get to a world where equity is no longer something we have to fight for, everyone has the rights and freedoms and is allowed access to the services that they deserve, I believe wide access to mental health care services is a crucial thing that we must achieve to get to that reality. He talked about the stigma that faces individuals facing mental health issues. The fact of the matter is, I think we all should seek therapy. I think it's important for all of our mental sanity. I mean, just working a normal 40-hour-a-week job, brings stressors on you, and you're not even putting on your family and responsibilities. You have a lot of stressors that do affect you, and that doesn't even take into consideration whether or not you are a part of a disenfranchised community like the LGBT community, if you are African American, if you are Latino. What stressors are you facing in the community because of the differences that you have? And a lot of individuals that's multifaceted. They have more than one issue that they're facing at the same time. I've been incredibly active with the LGBTQ community and seeing not only our rights and freedoms expanded, but also that those that we have achieved are protected. And what we are facing as a community right now is constant murders of transgender individuals of color. And so that racial equity lens falls right onto the plate of the LGBTQ community as well. So what my vision for a future where equity is no longer something we have to fight for, it's something we all experience every single day, is a tomorrow where if you are born female, that you are treated equal to every man or other person, and you have the same rights and freedoms, no matter what color or if you're a member of the LGBTQ community, no matter if you have disability, no matter if you are are coming from a place of poverty. You have rights and access to the same education, health care, and services by your government, that you are treated fairly when you are involved with the criminal justice system. It is a future where every statute, where every right, every rule falls with an equitable lens on everyone, and that when you walk down the street and you see someone who might not look exactly like you do, you see them as another human being. You don't see them as another.
Thank you. Commissioner Anaya,
Oh man!
if you could
How-
erase inequities, what does that look like?
How can I follow that? I think it's been put beautifully put by Commissioner Morrison. I think something that you touched upon that really relates is that access, right? How can somebody with erasing inequities, right? How can every child, every individual have access to health care, have access to an opportunity, to education, to housing, without barriers? A lot of the times, there's always this negative perception of like, oh, well, they need to pull themselves up by their bootstrings or by their bootstraps. But we need to see that there's always barriers. So even if there is some type of access, or we notice that there's not full access because there's certain little barriers that have been affecting unfairly, again, communities of color and other communities that have been marginalized for such a long time. So a world without inequities would definitely break down those barriers, would give everybody an opportunity to have the right information, the right rights, resources to make sure that that person is that full person in their full potential. And I think that it's our responsibility again, and I'm going to go back to a statement that I said before, that we look at that and that we examine it and how anything that does come to our votes and anything that we look at, that we're identifying and we're looking at it with that lens. It's very important. We have been very lucky to be where we're at. I know we all have our different backgrounds and our different struggles that we were able to overcome, and I see that as a blessing, and we need to make sure that we pay it forward and make sure that we're addressing some of the concerns in our communities. And I think looking at some of the inequities that we potentially may see on a day-to-day, it's our responsibility to have that voice and to see how we can address them.
Thank you. I think that's a good way to end this discussion. I want to thank Commissioner Kevin Morrison, Commissioner Alma Anaya, and Commissioner Dennis Deere for joining us today. We're happy to have our first annual Equity Week, September 16th through 20th, first annual. Very grateful for your help and support and good work on this issue.
Thank
Thank
you.
you, Madam
Thank you for your
President.
leadership.
And thank you all for joining us.